The first thing that you think about is cancer. That's it. That's it for me. And then you have someone say to you, I'll get you through it.
She held my hair back and she rubbed my back and you know, she was just, it's okay, it's almost over.
A doctor walked by and saw that we were kind of wandering, and he said, can I help you? And I was still in pain and bent over, and my wife said, we're looking for 3D, the spine center. Oh, he says, well, I'll take you over there.
The nurse who was with Carrie, it was actually shift change and it was time for her to go home. And she rode in the ambulance with Carrie, and then she had to ride back.
I couldn't eat, couldn't sleep, really pretty the lowest of low. And they brought me out of that. And they've kept my family involved, and they've given me hope through everything.
There's a concept here, but it's carried out by the people who work here. And there seems to be a sort of a collective energy to it that people really believe in what they're doing and how they're treating the patients.
They treat us all as a family. It seems like I'm almost royalty when I'm here.
I think the most important role that we serve here as providers for our patients is that we'll go to any extreme to make sure they get what they need.
No matter how tough your day is, no matter how depressing some of the situations can be that you're dealing in, you always dance with your patients.
The way that we're set up, having the providers in shared space and able to discuss amongst themselves, allows patients to receive higher quality of care.
We're all in one place and can reach anybody that you need.
It's not one doctor and another doctor kind of doing their own thing. The fact that they collaborate with one another is life-saving.
The collaboration here is amazing, just having that philosophy that we're all in this together.
We work shoulder to shoulder, team by team, to give the best possible care for the patients.
In the old days, shared decision-making was the doctor would share the decision with the patient, and that was it. And now we've moved beyond that to trying to include really what matters most to people.
In order to have a culture of caring, you need to have empathy for each other, you need to understand each other, and you really need to care for each other.
I'll be right back. Do you need anything when
I need to be able to talk to my healthcare provider and ask any question that I want. I would ask every possible question. I felt more involved.
We don't just assume that because we've ordered something, a medication or a treatment or a therapy, that you have to do it.
You know how your body feels. The doctors, they have an idea, but they can't know exactly how it feels. And to give you the decisions, you get to have your own customized care.
They never said, you need to do this. They said, these are your options. These are the statistically, you know, what might be best, but ultimately, you know, it's your decision.
Read the literature, went over the statistics to make the decision on if that was the right move for our child. And they didn't force us one way or another. They helped us make our decision.
This is the mission for Dartmouth-Hitchcock as a system. So if I could summarize it, as we advance health to achieve the healthiest population possible.
I'm gonna have you sit right there. Okay.
The sustainable healthcare is something that really has to focus on providing affordable healthcare to patients in their local community that can be sustained over many, many years.
Healthcare's not going back to anything that it used to be. It's just moving forward.
How can we better improve the health of our population, not just the healthcare? And then how do we do that in a way that's sustainable?
We want to prevent disease and illness as much as possible by encouraging and promoting a healthy lifestyle.
Outpatient care, I believe, is on the cutting edge of medicine because it's going to be much more cost-effective and efficient. If we can keep the population healthy, then we're not going to have as many health-related issues.
Can you imagine what it would be like if doctors, more nurses, had a greater educational background on the importance of nutrition?
Imagine if I'd come to Dartmouth-Hitchcock 20 years ago when I first started having back pain.
I like to imagine a system where you get the level of care that you feel you deserve.
Imagine if a healthcare system would treat everyone that walks through its doors as they've treated me.
Imagine if information flows from one institution to the other, across the country and even across international boundaries.
Have all the various healthcare providers in the state come together and work together as one entity.
The hospital is pretty amazing as it is, but if I had my own parking spot, that would be pretty awesome.
Imagine if you didn't have any diseases in the world, that this was all gone, and that everyone was healthy, everyone was up playing sports, everyone outside playing with their friends, and no one has to go through this. That's where I want it to go someday.